Hepatitis B. Hepatitis B is a genuine liver disease brought about by the hepatitis B infection, HBV. For certain individuals, hepatitis B contamination becomes persistent, which means it endures over a half year. Having persistent hepatitis B builds your danger of creating liver disappointment, liver disease or cirrhosis, a condition that for all time scars of the liver. Most grown-ups with hepatitis B recuperate completely, regardless of whether their signs and manifestations are serious. Babies and kids are bound to create an ongoing, enduring, hepatitis B disease. An immunization can forestall hepatitis B, yet there's no fix on the off chance that you have the condition. In case you're contaminated, avoiding potential risk can help forestall spreading the infection to other people. Side effects. Signs and side effects of hepatitis B range from gentle to serious. They for the most part show up around 1 to 4 months after you've been contaminated, despite the fact that you could consider them to be right on time as about 14 days post-disease. A few group, generally small kids, might not have any indications. Hepatitis B signs and manifestations may include stomach pain, dark urine, fever, joint pain, loss of appetite, nausea and vomiting, weakness and fatigue, yellowing of your skin and the whites of your eyes, jaundice. When to see a specialist. Contingent upon that you realize you've been presented to hepatitis B, contact your primary care physician right away. A preventive treatment may decrease your danger of contamination in the event that you get the treatment within 24 hours of openness to the infection. In the event that you think you have signs or manifestations of hepatitis B, contact your PCP. Causes. Hepatitis B contamination is brought about by the hepatitis B infection, HBV. The infection is passed from one individual to another through blood, semen or other body liquids. It doesn't spread by wheezing or hacking. Regular ways that HBV can spread are sexual contact. You may get hepatitis B in the event that you have unprotected sex with somebody who is tainted. The infection can pass to you if the individual's blood, salivation, semen or vaginal discharges enter your body. Sharing of needles. HBV effectively spreads through needles and needles tainted with contaminated blood. Sharing IV medication gear puts you at high danger of hepatitis B. Unplanned needle sticks. Hepatitis B is a worry for medical services laborers and any other individual who interacts with human blood. Mother to youngster. Pregnant ladies contaminated with HBV can pass the infection to their infants during labor. Nonetheless, the infant can be inoculated to try not to get tainted in practically all cases. Converse with your PCP about being tried for hepatitis B on the off chance that you are pregnant or need to get pregnant. Intense versus persistent hepatitis B. Hepatitis B disease might be either fleeting, intense, or enduring, constant. Intense hepatitis B disease endures under a half year. Your safe framework probably can clear intense hepatitis B from your body, and you ought to recuperate totally inside a couple of months. The vast majority who get hepatitis B as grown-ups have an intense contamination, however it can prompt ongoing disease. Ongoing hepatitis B disease keeps going a half year or more. It waits on the grounds that your invulnerable framework can't ward off the contamination. Constant hepatitis B disease may endure forever, perhaps prompting genuine sicknesses like cirrhosis and liver malignancy. The more youthful you are, the point at which you get hepatitis B, especially infants or kids more youthful than 5, the higher your danger of the disease getting constant. Ongoing contamination may go undetected for quite a long time until an individual turns out to be genuinely sick from liver infection. Risk factors. Hepatitis B spreads through contact with blood, semen or other body liquids from a contaminated individual. Your danger of hepatitis B contamination increments on the off chance that you have unprotected sex with different sex accomplices or with somebody who's tainted with HBV. Offer needles during IV medication use. Are a man who has intercourse with different men. Live with somebody who has a persistent HBV disease. Are a newborn child brought into the world to a contaminated mother. Have some work that opens you to human blood. Travel to districts with high disease cases of HBV, like Asia, the Pacific Islands, Africa and Eastern Europe. Complication. Having an ongoing HBV contamination can prompt genuine confusions, for example, scarring of the liver, cirrhosis. The aggravation related with a hepatitis B disease can prompt broad liver scarring, cirrhosis, which may debilitate the liver's capacity to work. Liver malignancy. Individuals with persistent hepatitis B contamination have an expanded danger of liver malignant growth. Liver disappointment. Intense liver disappointment is a condition where the indispensable elements of the liver shut down. At the point when that happens, a liver transfer is important to support life. Different conditions. Individuals with constant hepatitis B may foster kidney infection or aggravation of veins. Counteraction. The hepatitis B immunization is commonly given as 3 or 4 infusions more than a half year. You can't get hepatitis B from the immunization. The hepatitis B immunization is suggested for babies, youngsters and teenagers not inoculated upon entering the world. The individuals who work or live in a middle for individuals who are formatively impaired. Individuals who live with somebody who has hepatitis B. Medical services laborers, crisis laborers and others who come into contact with blood. Any individual who has an explicitly communicated contamination, including HIV. Men who have intercourse with men. Individuals who have numerous sexual accomplices. Sexual accomplices of somebody who has hepatitis B. Individuals who infuse unlawful medications or offer needles and needles. Individuals with constant liver infection. Individuals with end-stage kidney infection. Voyagers wanting to go to a space of the world with a high hepatitis B contamination rate. Play it safe to keep away from HBV. Alternate approaches to decrease your danger of HBV include: know the HBV status of any sexual accomplice. Try not to participate in unprotected sex except if you're sure beyond a shadow of a doubt your accomplice isn't tainted with HBV or some other explicitly communicated disease. Utilize another latex or polyurethane condom each time you engage in sexual relations in the event that you don't have the foggiest idea about the well-being status of your accomplice. Recall that in spite of the fact that condoms can diminish your danger of contracting HBV, they don't dispense with the danger. Try not to utilize unlawful medications. On the off chance that you utilize illegal medications, find support to stop. In the event that you can't stop, utilize a sterile needle each time you infuse unlawful medications. Never share needles. Be mindful about body penetrating and inking. In the event that you get a puncturing or tattoo, search for a respectable shop. Get some information about how the hardware is cleaned. Ensure the workers utilize sterile needles. In the event that you can't find solutions, search for another shop. Get some information about the hepatitis B immunization before you travel. In case you're making a trip to a locale where hepatitis B is normal, get some information about the hepatitis B immunization ahead of time. It's generally given in a progression of 3 infusions over a 6-month time span.